Okay, this is the Johnson and Strom classification, and it's used for posterior tibial tendon dysfunction. It's very high yield because you will use it for all of your flatfoot cases that present, okay? So in order to remember that, I have Dwayne "The Rock" Johnson. He is very strong, and he's pointing to his foot, okay? So flat foot. So Johnson and Strom, flat foot, okay? So it's stage 1 to 4. It's very easy. It's just it's usually based on clinical symptoms. You'll get some symptoms, but I also have imaging findings here as well that can help you. And then finally, treatments. Treatment guidelines are pretty high yield as well. So stage 1, medial foot and ankle pain. That's it. Not much there. It's just the start. Maybe they'll have some PT tendon tenderness at the insertion. Stage 2 is a flexible flat foot. You start seeing that arch collapse. Stage 3 is a rigid calcaneal valgus and decreased STJ range of motion. Okay, so their calcaneus is actually following the flat foot, and they have a valgus. Okay, and 4, the ankle is involved. It's so bad that now the talus and the ankle are in valgus, and it's causing some more diffuse problems throughout the limb. In order of imaging findings, number 1, it's just if they just have medial foot and ankle pain, the PT tendon's probably just slightly, torn or attenuated. So they're just going to have some normal. They're going to have normal length, but they'll have just some mild degeneration on MRI. Okay. Stage 2, they have a flexible flat foot. What would allow them to have a flexible flat foot? Well, the PT tendon is attenuated or ruptured. Okay, that allows it to collapse. Stage 3, they have a valgus, which is only possible with a complete rupture. Okay. And stage 4, the ankle is involved. They're going to have ankle arthritis, of course. So let's go on to treatment protocol. So you're going to get a flat foot. You're going to have to stage it based on the symptoms usually, and they're going to say, what do you want to do? Well, for stage 1, usually we stay conservative with orthotics or supports, anything like that. Maybe you'll do a tendon debridement, okay? Stage 2, this is definitely an FDL transfer case, and you can do some other osseous work. For example, a medial calcaneal slide osteotomy or the Kutsukianis. You can do a medial column fusion, a TN fusion, an STJ fusion, as well. Okay. Stage 3. This is definitely a fusion stage. Triple arthrodesis is common, or you can just do the TN or the STJ fusion. Okay. And then stage 4 finally is a triple arthrodesis for sure, maybe an ankle fusion, maybe a pantalar fusion in extreme cases. Okay. But the ankle's involved, so you want to usually fuse the ankle. Okay. So the treatment protocols originally described by Johnson and Strom were more conservative than I've listed here. I've updated them with recommendations from Pomeroy, his article in 1999, which is one of the landmark articles. But it's surgeon preference, it's subjective. You need to look at the x-rays and the dominant plane of deformity, and you need to also know your flat foot reconstruction surgeries, which I've done videos on as well. Okay. So I hope this helps.